Cardiac compromise is a blanket term that refers to many kinds of problems with the heart. Just as there are many problems, there are a wide variety of signs and symptoms associated with these heart problems. As an EMT, it is much safer to treat all patients as though they are having a heart problem, rather than diagnose the specific disorder. With that in mind, let's take a closer look at 5 of the most common heart conditions. Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. 2 conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal. Acute myocardial infarction. Acute myocardial infarction occurs when a portion of the myocardium, heart muscle, dies as a result of oxygen starvation. The dead area can no longer pump. This can lead to cardiac arrest, shock, pulmonary edema, or congestive heart failure. In some cases, heart attack patients suffer cardiac rupture as the dead tissue area of the heart muscle bursts open. Medications called thrombolytics dissolve clots that block coronary arteries. Other patients receive an angioplasty, a balloon device, to open the arteries. Aneurysms. Weak spots that dilate are known as aneurysms. When a weakened artery bursts, rapid internal bleeding occurs and tissues beyond the rupture can be damaged. A rupture of an artery within the brain can result in a severe stroke. If a major artery ruptures, death from shock can occur. Arrhythmia. A malfunction of the heart's electrical system will generally result in an arrhythmia. Electrical disturbances within the heart result in arrhythmias, including bradycardia, abnormally slow, less than 60 beats per minute, tachycardia, greater than 100 beats per minute, or rhythms that are present when there is no pulse, including ventricular fibrillation, ventricular tachycardia, pulseless electrical activity, and asystole. Congestive heart failure, CHF. Congestive heart failure, CHF, is a condition of excessive fluid buildup in the lungs and other organs because of inadequate pumping of the heart or of failure of the lungs to function properly. Congestive heart failure can be caused by diseased heart valves, hypertension, or some form of obstructive pulmonary disease. The symptoms of CHF may include tachycardia, shortness of breath, elevated blood pressure, cyanosis, profuse sweating, cool and clammy skin, pulmonary edema, pedal edema, or the coughing up of frothy white or pink sputum. Late signs include engorged pulsating neck veins or enlarged liver and spleen with abdominal distension.